PolicyLink is really driven by a focus on equity. Our mission is to advance equity by lifting up what works. There are a couple of things there that require some rigor in terms of data. If you're lifting up what works, you need to really have some way of knowing that it does work. And utilizing data about who's being served, what progress is being made, where did people come in, where were they when they left. Using data to be able to say, we know this program makes a difference because the data tells us so, is one way to be able to have some assurance that you really are lifting up what works. Also, equity really is an attempt to do something about the gap between where children are and where they need to be to reach their full potential. Where are they in terms of school achievement, in terms of weight, in terms of being able to have the kind of exercise that we know that they need to have to be healthy. Looking at where they are and where they need to be allows us to see the gap, and the work of equity is to close that gap. Equity really means just and fair inclusion into a society in which all can participate and prosper. And the work of equity is creating the conditions that allow all to reach their full potential. And so being able to know that we're making progress on the equity front requires that we have some data, that we have real results, that we have the capacity to measure how we're doing. And being able to lift up what works really brings with it a necessity to be able to assure those people for whom we say, here's a program you ought to think about. Having a little data to underscore that, to really show that, really does help us to do our work in a way that is stronger. I must say, I started early on in my career when I used to run an organization called the Urban Strategies Council, really getting this idea of data-informed work into an entire community. We gathered the data about school achievement, about what was happening with young people, and made it available to the community. And the thing that really pleased me was how receptive the community was to trying to understand data and utilize data to make decisions. One of the first things that we worked on was infant mortality. And at the time that the Urban Strategies Council started working on the infant mortality issue, Alameda County, which is where Oakland sits, got its money to deal with infant health and well-being and just spread it across the community. Urban Strategies Council used data and mapping to show that the highest rates of infant mortality were concentrated in just a few communities. Once we showed that data to the community, it organized itself about demanding that the resources actually go to the community. Actually, the highest rates of infant mortality were in the Black community, and the Asian health clinic and the Latino health clinics both came together with the ones that were working in the Black community and said, we want to help you focus in this area. This is where all of our resources should be going to deal with this issue of infant mortality. So the data allowed the community to organize itself around results, and I think that's a powerful thing.